Best regard, teacher and future professional doctors. I introduce myself. My name is Michael José Rivera González. I am doctor specialist in pulmonology. I completed my higher education at the Facultad Multidiciplinaria Oriental of the city of San Miguel of the Universidad Nacional del Salvador, obtaining my doctorate degree in medicine. I successfully passed the National resident exams, obtaining my grade to 7.97, thanks to which I managed to enter the pulmonology specializations. I completed the first years of the pulmonology specialization at the Central Branch of the Universidad del Salvador. Months later, they began launch international scholarship programs for youth talent from the Latin America region, with our alma mater excellent for students participate. To which several fellows medicals residents underwent a serious exams to measure the level of English the seeker passed this day 7. That is unique. I hated levels of English. The grades I obtained was 8.4, so I was selected to continue specialization in my area, obtaining a scholarship along with 47 medical colleges. We were sent especially at the University of Oxford in Wilton Square, Oxford, United Kingdom. The duration training of Oxford is the pulmonology specialization is 4 years. Fixed coverage that caught my attention was cardiology. However, my grandmother inspired me to specialize in pulmonology, telling me that if I manage to become doctor, as God allows me specialist, she would like me to care for parents with respiratory problems. Once I returned from Oxford, I started working at the Hospital del Salvador in San Salvador. But the population to which I want to dedicate myself is the populations of Amsterdam, El Salvador. So I currently work at the Hospital Regional del East, and also serve at the Hospital de Especialidades Nuestra Señora de la Paz in San Miguel. What is pulmonology? Pulmonology is the medical specialist that focuses on the prevention and the treatment of the diseases of the respiratory system, especially the lungs, but also the pleural and mediastinum. Pathology: diseases that can affect the upper and lower respiratory tract are numerous. Talk among the most frequent the following can be COPD, chronic obstructive pulmonary disease is a pathology in which a fall in the lungs significantly limited is as progressive evolutions as is not received with dyspnea is mine. Symptoms are sometimes accompanied by chronic cough. Pneumonia: it is an infectious disease that can be caused by different types of bacteria. Its symptoms are fever, chest pain, cough, expectorations, difficulty breathing, very and people. It is especially serious. Bronchial asthma: it is a chronic disease that presents with intermittent episodes of respiratory distress caused wheezing. In many cases, as with childhood asthma, it is caused by an allergy. Sleep apnea: It is involves successive respiratory arrests during sleep, which causes unusual tiredness during the day. And the emphasis to fall asleep will carry or usual activities. Pleuteritis. It is usually caused by respiratory infections that causes inflammations of pleural membrane that surrounds the lung. A common effect with a dry cough and acute chest pain. Bronchitis. The deafness, the inflammation of the mucous membranes that lines the bronchs. It may be acute or chronic. In the first case, it is a viral infection, but when it is chronic, it is a form of COPD. Trachemic, pleural dryness. It is performed in case of pleural effusions or pneumothorax, and involves performing a vector in the thorax sound which took is inserted to promote the exit or the leaking and kick the lung space, preventing the entry or outside air. Medicines: antibiotics, bronchodilators, antituberculosis drugs, expectorants, mucolytics, corticosteroids. There are many medications that can be used in the treatment of respiratory diseases, either for curative purposes or to control or avoid symptoms. Oxygen therapy. Oxygen is administered in concentration higher than those in the air. It is used in patients with breathing difficulties or hypoxia. Low concentration of oxygen is the blue. CPAP is full name continuous positive airway pressure used an air pump to keep the trachea open and prevent air collapses in patients with certain respiratory pathologies. Pneumonectomy. It is a surgery in which the total or partial removal of a lung is performed, which may be indicated in case of cancer. Emphysema lungs are affected as the laxis and other pathologies of respiratory system. Lung transplant. The pathologies that more frequently require a lung transplant are COPD, fibrosis pulmonary fibrosis, or primary pulmonary hypertension. Reflections. The road to success is difficult, however, to persist until you reach the goal. Believe in yourself that with effort and dedication you will be a good professional. Thank you so much.